Well, welcome everybody to the podcast series on innovative healthcare solutions. It's sponsored by the Conference of Consulting Actuaries. Now, just as a reminder, if you hadn't seen all the ones that we've done to date, and we're well over about 20 by this point in time, these podcasts are a series of interviews with professionals focused on delivering innovation in healthcare. And these sessions are offered really to provide insight about what's really transpiring in kind of our ever-changing environment of healthcare. I'm Ed Pudlowski. I'm president of Morningstar Actuarial Consulting, and I'm also chair of the healthcare community within the Conference of Consulting Actuaries, and I'm going to be your host for today's discussion. Now, for today, I'm really delighted to be joined by David Stein. He's co-founder and CEO of Ash Wellness. David, thanks for being here today.
Thank you for having me. Really appreciate it.
Yeah, I'm really looking forward to this interview because you've got something that I think is fairly unique in the market. So now, you know, Ash Wellness is a health testing platform, and I'm going to jump into maybe what that means in a little bit. But
hmm
you really started the company, David, with the focus on a subset of the population that may be harder to reach than others for access to required testing. Can you elaborate on that a little bit and give our audience an idea of who we're talking
Absolutely.
about?
Yeah, absolutely. So, as you mentioned correctly, we're an at-home testing platform, and we partner with currently we partner with health plans and digital health companies and public health departments to turn on their at-home testing solutions. But you're right, where we started was honestly out of a personal pain point in accessing testing myself.
Hmm.
And we started actually on the consumer side doing at-home sexually transmitted infection testing for the LGBTQ plus community, and built honestly, version one of the platform and the experience around reaching those harder to access populations and populations that um, maybe didn't even necessarily feel comfortable coming in person to do testing.
The key to accessing that population.
Yeah, I mean, I think, one of the biggest blessings for Ash has been COVID, in a weird way,
Hmm.
right? So we launched right before COVID, and what seems ubiquitous now and normal, just in that everyone is accustomed to doing testing from home. 5 years ago, pre-COVID, was more or less unheard of. And so I think the first kind of key to that was COVID in of itself, really popularizing the idea that we can test from home. The efficacy of doing so is the same as doing in person, etc. Beyond that, I think, because we started in the space we did with the population we did, we designed those programs really with a emphasis on like the user journey and experience and making sure we really understood what those pain points were for those users. So I know it sounds kind of high level and maybe even cheesy, but uh
No,
having
no,
just a
not at
really
all.
user thank you, having just a really user centric approach to it has been the key to our success. And we obviously went from just doing sexual health testing on the direct consumer side to completely retiring that product and exclusively focusing on the B2B side of the business, and as a result have taken kind of those learnings of how you build a good testing program and understand those users, to all the different populations we're working with on the health plan side. And I'd argue those populations are in some cases harder to reach, and even more diverse in a different nature, but still more diverse.
So you've evolved quite a bit then from kind of your original starting point to be more inclusive of a greater portion of the population that has needs for testing. Can you talk a little bit about that and how maybe some of the learnings that you had with the LGBTQ community has kind of translated into just, generally getting anybody, people like me that were never used to doing at-home testing to do something like that now?
Absolutely, yeah. I mean, I think, the biggest thing is It's pretty simple, honestly, just in thinking about how people want to interact with their healthcare and thinking of and understanding and really asking those questions. And then also thinking about how people want to be communicated to. So a good example of this that, we took from our origins to what we're doing now is really like the means and medium in which we're communicating with members on behalf of our customers, right? So there's certain population types that don't want to ever receive an SMS. There's certain population types that don't ever want to receive paper mail, and vice versa, right? There's certain
Right.
population types who are never going to answer their phone from an unknown caller. Um, and so really kind of testing all of that and understanding and see and doing so in a way that we can, what I like to call uh some of the newer stuff we're doing when we're pitching this to health plans is what I like to call appropriate engagement. So everyone, sells this engagement methodology and their ability to actually engage members and get them through whatever kind of intervention they're pushing. Um, but I think what we've really nailed down is like what is appropriate engagement for that type of population. And the way we get there is just running really small tests and building up from there.
So, your what type of testing do you offer now on your platform? And maybe, how since that's really kind of evolved kind of the initial population you're focused on, maybe talk about, what type of testing that you're really focused on now these days. And maybe, how your platform differs from traditional methods of testing, right?
Absolutely. Yeah, so I guess just starting from the top there, right? We run about 150 different biomarkers now. So we
Hmm.
have the ability to test in all 50 states from home across 150 different biomarkers. We can do finger prick blood. We also work with we're what we like to say a device agnostic platform. So anything that has been approved for at-home self-collection and has kind of the appropriate clearance to do so, we can turn on with our platform. We do, as I mentioned, blood, swabs, urine, stool. I'm trying to think if there's any other sample types. And as far as the programs that we're focusing on now and really are catching kind of steam, I'd say sexual health is still a huge part of it because the use case, I think, just generally, excuse me, around um, both doctors and patients or members not wanting to talk about sexual health in person is a very good
Mhm.
use case to say, let's do this from home. Let's do this asynchronously. Beyond that, on the health plan side, as far as the different like gap closure programs we're running for HEDIS and STARS, a lot of cancer screening, so colon cancer screening, HPV. We're doing A1C testing, KED testing. So a lot around kind of chronic disease states and managing and understanding where member populations are with that. And then more on the like direct consumer side in the companies that we're working with who are, positioned as a D2C company, GLP-1 testing is huge. So doing kind of the onboarding and maintenance testing around that. PrEP's the once daily pill to prevent HIV. So pre-exposure prophylaxis. There's required testing for that. So a lot of the medication adherence programs where, it's a medication that a patient is on for an extended period of time, and as a result, they have certain, biomarkers that they have to get tested regularly to stay on that medication. And then I think if I answered in correct order, your last question was just around um, the difference in our platform compared to some of the more traditional players, and I can also speak to the difference in our platform compared to some of the less traditional players, but who are our direct competitors. And so, for the more traditional players like your LabCorp, your Quest, I think first and foremost, what people mix up about Ash is that we are not a lab, right? So, you know, a lot of these traditional players are labs, and their collection centers and their whole, you know, apparatus and logistics machine is in nature a lab, and running that and thinking about kind of the expertise that goes into that is very different to our expertise, right? So what
Mm.
we do is we partner with laboratories, and we partner on all the physical kind of components of that testing experience. And so we go and find and source and validate kind of best in class labs for at home cell collection and the LDT space, or lab developed test space. And then we'll integrate with them and onboard them onto our platform. When we want to expand our testing menu or geographies or whatever. So that's, I think, the first major difference. From a user experience side, though, I think, what has helped Ash really grow over the last couple of years is that there is a huge drop off rate from a consult to a doctor ordering an in-person LabCorp request blood draw or sample collection, right? So there's just the annoyance, right, of like having to go and schedule a LabCorp request appointment.
Yeah.
But B, what I think, these harder to reach populations, what we don't often always think about, right, is you have to have transportation. If you're an hourly shift worker, these centers are usually open 9 to 5. So you're taking off time from work. You're not getting paid for that time to go, access this healthcare. Childcare is a big thing. We hear this a lot, right? Okay, so I'm going to bring all my kids to the LabCorp, and so a lot of these things that are, I think, just social determinants of healthcare generally impact what we're doing, but it's truly why I think it's gained so much momentum and steam is because yes, we started in the LGBTQ plus space, and a lot of the origins of how we build things and think about designing programs and appropriate engagement lend itself from that experience. But you know, all of these populations in different ways have their challenges and access problems, and a lot of those things are things I think that we just almost take for granted and don't spend a lot of time thinking about as to why a patient doesn't get through that continuum of care.
So you're really in kind of thinking about this from the health plan perspective rather than kind of the direct to consumer, or I think you referred to it as kind of the B2B model. You're really kind of a boost to their existing programs that they have in place to do testing, right? Is that a
Correct.
kind of a
Correct.
okay?
Yeah. So I always like to say we're not replacing in-person testing. Um, because we can't do all of the tests that you can do in person from home, right? A great example of this is we can't do an intravenous blood draw,
Hmm.
which as a result, right, gives us limitations. But B, there's use cases where like in-person testing is better. And there's use cases where at-home testing is better. And so whenever we start like a health plan sales conversation and someone asks the question, well, what's the pricing compared to LabCorp Quest or, our current vendors? And I'm like, that's the wrong way to think about it.
Right.
But yeah.
Yeah. So talk a little bit about how you improve engagement, right? I don't know if you have kind of statistics around that or that you can
Mhm.
share, but there's got to be, in some sense, if you're talking to the health plans, they've got to see that there's, some measurable boost in that engagement level.
Certainly. So I think the first nuance of this space to understand, and um, it gets looked over quite a bit if you're not like intimately in this space every day. But just because we send out a test kit does not mean a patient will return said test kit.
Right.
Um, so the benchmark for what is considered to be like a return rate on a testing program to date is pretty bad. So and I think there's a few things you have to like qualify that with. One is these testing programs are usually on the health plan side going out to members who haven't requested those tests.
Mm.
So to even engage them in the first place and to show that I, I guess to back up a little bit, right? A good example of this is like a health plan might say, hey, uh, a HEDIS gap closure metric is A1C testing. we have, let's say, 100,000 members that fall into that category that we want to send test kits out for. Um, those members, in most cases, don't even know that test kit is coming. So, the benchmark return rate on those programs, when you do zero engagement and zero kind of free um, program education for those members is about 20%. What we've
Oh,
been able to do over the last couple of years with the partners that we've been able to get in front of, right, and prove out through pilots and whatnot, is we've almost doubled those return rates in every single
wow.
program we've run. And that's real, return on investment, both for the health plan, just in that A, they're sending out 100,000 test kits as an example, right? And 80% aren't going to be returned. That's a lot of money left on the table. But
Right, right.
B, every box they check on that HEDIS metric is improving their quality score. So there's a lot to think about there. To answer the second part of your question, just around, our engagement and what makes it kind of unique and better. There's a lot of table stake items that I think people take for granted, but when we run the test just to see like one-to-one to some of the incumbent players versus Ash, um, the fact that we white label the entire experience creates a huge boost, right? So, a lot of our competitors will send out testing kits that say their company's name on it. And if I'm an Aetna member for New York and I get a Let's Get Checked testing kit, I'm like, who is Let's Get Checked? Where did this come from? I didn't ask for this. What am I supposed to do with this? And I throw it away. So we white label that entire experience, right? So instead of it saying Ash, powered by Ash testing kits on it, it says Aetna, New York, whatever my health plan is on that physical testing kit. And, you'd be surprised at actually what a big lift that provides in terms of the return rate, because people then start to understand kind of the engagement and stickiness of their health plan versus just getting a random test kit from some random company. Um, Beyond that, back to like the appropriate engagement side. So, um, thinking about how members want to be spoken to based on their population types, based on their geographies, based on socioeconomic kind of data, and what that means in practice, right? Is we're texting some members, we're doing live phone calls to other members, we're doing paper mail to some members, and at different points in this process, right? So there's kind of notification points that we can kind of custom design with our health plan partners to say, hey, let's let a member know that in the next couple of weeks a test kit is coming to them for A1C testing, and this is why it's important to do that test. Let's let them know via SMS that they should expect that test kit on their doorstep in the next couple of days. Let's let them know when it's actually arrived. Once it's been 4 or 5 days of it being at the doorstep and we haven't had a scan return on that test kit, let's ask them why they haven't returned it and see if they
Mm.
need help. And so a lot of those um, just appropriate kind of engagement points and mediums that make sense for that population. And then more recently, and this has been game changing, and I'm sure not surprising to you or anyone who's potentially listening to this podcast, is really just layering in AI tools to help us kind of perfect that and learn faster as to how to engage and when and in what medium.
Great. So what I'm hearing in kind of your value proposition is not only are you, getting quicker engagement for those at-risk populations, you're increasing engagement levels when you're put in alongside kind of the traditional methods that we typically see in health plan, which has got to have a kind of a meaningful impact on the overall health plan cost too.
Absolutely. It, I'm sure it's always a hard selling to health plans is very difficult and takes a long time. But I think something that is cool about our solution and product is, you know, a lot of these health plans already have at-home testing programs running, and
Hmm.
we get to go in and say, hey, not only can we save you money on the testing program because we're doing appropriate engagement and we're thinking about the populations we're actually sending these test kits to. We're not just blanketly sending it to everyone that falls into that category. But we can also increase kind of the ultimate uh, um quality score for you by increasing
Yeah,
this engagement. So it's cost saving and hopefully at the end of the day also revenue generating, in that it helps these health plans kind of increase their quality scores.
great. David, is there anything I didn't ask that I should have?
That's a great question. I think, the the one thing that I like to emphasize, and we spoke about this, but just for the purposes of if if anyone listening should take one thing away, is I think this is not like a complete replacement of in-person testing, right? So it's a complement to it, and it's a tool really to access your hardest to reach populations. Um, and I think, in today's just world of mistrust in healthcare and health plans, and what are they even doing for us as members, right? It's an opportunity for our partners to create an actual uh, positive sentiment experience with these members, where at least from a member point of view, they say and can see, hey, they care about preventative health care and they're doing this testing on the upfront. And I think for the health plan, right, everybody wins. We're helping you increase your quality scores. We're spending the money in a smarter, more kind of learned way. And so uh yeah, I think that's the last and really only thing I would add.
Right. I think that's an important point too, because I had just read a study that was conducted in Brazil, but it looked at the linkage between employee satisfaction in a health plan and their overall profitability. Not all health plans are in the for-profit business, but when you look at it in
Right.
terms of that measure. So yeah, certainly that's another added point to the value proposition that I didn't outline before. David, thanks so much for this interview. I'd really like to encourage all of our viewers who participate who are also part of healthcare community within the Conference of Consulting Actuaries to continue any discussion about these insights that were shared here on this platform. Just a reminder, if you're not a member, you can easily be one. Just go out to the CCA website at ccactuaries.org and you can sign up, and then you can become a member of the healthcare community platform and enjoy the benefits not only of that platform but the other benefits of the CCA. David, thanks again for being here today and sharing your insights, particularly around ASH wellness and what you're really doing to drive engagement in the more at-risk populations and the innovation that you're putting into healthcare. I really enjoyed this, and I'm sure our audience did as well.
Thank you for having me, and thank you for the opportunity to be in front of your audience. Thanks.